What is a heart scan and what does it measure? Who should consider getting a heart scan? My name is Donovan Beswick. I'm the Director of Imaging Services here at Norman Regional Health System, and I'm here to answer these questions for you. A heart scan is a CT looking at the coronary arteries of your heart. It will not only show us the form of your heart, but it will show us specifically your coronary arteries and calcified plaques within those arteries. This will show up earlier than other warning signs for potential high risk for coronary artery disease. Early detection of heart disease is so important because it's so prevalent in our society today. Heart attacks happen very frequently without early warning signs. So knowing that you may be at risk allows us to have your primary care physician being able to follow up on this and get you in touch with cardiology in advance to have more specific testing on your heart for coronary artery disease. The guidelines for heart scans are for men over the age of 35, women over the age of 40, who have a family history of heart disease, high blood pressure, sedentary lifestyle, high cholesterol, or anybody just wanting that peace of mind after those ages have been hit. People who should not get a cardiac scoring are people who have already had a heart attack, people who have already had coronary stents, or have known heart disease that's already being followed by a cardiologist. When you show up for your heart scan, you'll come to the CT room that's behind me. We will put some leads on your chest because this is gated with your heart rate. Our goals are to have a low heart rate to get a really good score. So no caffeine the day of your study. Try to calm yourself and be prepared. After the study is done, it takes about 5 minutes total. We'll get you up off the table. We'll go and process your images, and we'll provide you with an early score, a report that's specific to you that talks about how much calcium is in your coronary arteries and where that is located at. After that, your images will be read by one of our board-certified radiologists, and a finalized report of your image reads will then be available to you. A perfect score is 0. That means when we're looking at your coronary arteries, we're seeing no calcification in your vessels of your coronary arteries. A score of up to 100 is kind of an average score. Scores over 100 up to 400, those are what we would consider above average. Scores can go up into the thousands. Patients with an above average or high calcium scoring on their coronary scan will then be referred to cardiology for follow-up. You don't need to have a heart scan every 6 months. We actually have a limit of once a year. So we're monitoring and reducing the amount of radiation you're getting as well. So after you get your baseline report, it's important to wait at least a year between follow-ups. If your score is 0 or very minimal, you can wait longer than a year between follow-ups. Things that you can do in your everyday life to keep your score low: physical activity, living a non-sedentary lifestyle, anything that reduces your cholesterol, your blood pressure, reducing stress in your life. Those things are the things that you want to do to maintain a low score and maintain good heart health. Since February is Heart Month, here at Norman Regional, we would like to reach out to everybody who is a man over the age of 35, a woman over the age of 40, who has concerns about their heart health. If you have always wondered if you are at risk for a heart attack, you have high cholesterol, high stress, high blood pressure, or just concerns or family history, please take this time to schedule your $50 cardiac scoring with Norman Regional and have some peace of mind during this time of year.